Well, welcome back to my video series, People Who Make a Difference. I'm here with my friend and Dr. Bill Warnock of the Champlain Center for Natural Medicine in Shelburne, Vermont, in the Burlington area. And today we're going to talk about vitamin D. Is that right, Bill?
That's right. And again, thanks for having me on your show.
Oh, sure. It's fun to do.
All right. So what do you know about vitamin D?
I know that if you get a lot of sun, you get some vitamin D from that. And I know that it comes from milk sometimes. And I know from you that it's an important thing for people to have enough of.
Well, all those things are correct. So let's just talk about those. When a person has sun shining on their skin, that ultraviolet light changes cholesterol into vitamin D. If you consider that our ancestors were from the plains of Africa on the equator, and they spent most of their days outside hunting with very little clothing. Why do you need it on the equator, right?
Right.
A person in that sort of circumstance can make upwards of 25,000 international units of vitamin D a day.
Really? Wow, okay.
That is correct. We do not get vitamin D from any food. In fact, milk has vitamin D added to it through a process of exposing it to ultraviolet light, which again changes that cholesterol into vitamin D.
I didn't know that.
So, to get that 25,000 units of vitamin D from milk would take over 250 cups.
That's a lot of milk to drink in a day.
I know. So it's not really practical to get optimal levels of vitamin D from milk, although certainly a little bit in milk is better than none. I have to say that. In my mind, a bit of a mystery as to why we need something so important that we can't get from food, and we can't make ourselves other than exposure to the sun.
Right. So you're saying the only way the body makes vitamin D is through that sun exposure?
Correct.
Okay.
Vitamin D acts as a hormone in the body.
Oh.
Now, the way hormones work, and I'm not going to spend a lot of time with this, but the way hormones work in the body, whether it's a thyroid hormone or adrenal hormone, estrogen, testosterone, it has target genes that it activates to change the way that cells' metabolism is working.
Okay. Say a little more about that.
Well, we have about 35,000 genes in our body, and a hormone can affect anywhere from 10 to 1,000 of those genes. And changing the genes expression, activating them or turning them off, determines how our cells act, really.
So I can conceive of that. And so now in terms of practical outcomes in health or how is it that getting enough vitamin D makes your health different from not? And, is it true that most people don't have enough vitamin D for optimal health?
Those are a lot of questions. I'll try to get to them.
Okay.
First of all, the hormones that have the greatest effect, like I said, maybe affect 1,000 genes, but it's more likely somewhere less than 500. This is a relatively new science, so there's a lot to learn yet. But vitamin D affects 7,000 genes in our body.
Wow.
And Some of those genes are repair genes, repairing our DNA, cell membranes, other parts of the cells. Some of them activate the immune system. Um, some of those optimize other activities in our body, like neurotransmitters, stress hormones, things that basically, if we're to put it in a nutshell, help us to be healthier.
Mm-hmm. I mean, just the things you named that's a pretty wide range of things affected by vitamin D.
Nothing affects, no substance affects as many things in our body as does vitamin D.
Wow. So that's why it was at the top of your list of supplements that almost everybody should take?
That's correct.
I got you.
We know that not enough vitamin D causes a disease called rickets, which is a soft bone disease, because one of the functions of vitamin D is to help absorb calcium and to have the body regulate calcium in such a way that our bones are strong.
Well, I mean, I think you should go on and just kind of say what the different health benefits of getting enough vitamin D would be for us.
Okay, let's talk about some numbers first. How's that?
Sure.
Recent studies out of Scandinavia show that blood levels of vitamin D that have the greatest health benefits are above 75 nanograms per milliliter. Now, that doesn't really mean much to most people out there because they've never had a vitamin D test.
Right.
But I can tell you that I've tested thousands of people for vitamin D levels in Vermont, and no one has been above 30 nanograms per milliliter.
And that optimal level is how many?
Above 75.
Oh, wow. So that's why everybody needs to take it.
That's correct. Now, the standard of most labs is between 30 and 100 nanograms per milliliter of vitamin D in your blood. So that 30 is a pretty universally accepted number that you want to be above.
Got it. So but most people, if they're above it, it's just a little bit above it.
Right. A lot of doctors say, oh, if you're 32, that's adequate. But according to the studies, that's not really true. When I went to school, and it was, a less conservative school, being a naturopathic medical school, we learned that vitamin D was toxic. This was back in the mid 80s.
Oh.
And anything above 800 IUs could be toxic. A recent 16-year retrospective study published in Lab Medicine, the Journal for the American Society for Clinical Pathology, came to the conclusion that vitamin D was not toxic in the levels that people could get it as a supplement.
Meaning that by taking supplements, you're not going to make yourself get to a toxic level?
Right. The only exception was in liquid forms of vitamin D.
Oh, I see. Well, yeah, so I guess you have to mention that, but that's really not likely for anybody who's being sane about it at all.
No, that's very unlikely. And what I found with my patients in Vermont, and it would vary from place to place depending on how much sun a person was able to get, but you have to remember that that's direct sun on the skin, and sunscreen blocks the production of vitamin D as well.
Oh, wow. So that's a catch-22. If you're going to try to get it from sunlight, you expose your skin to maybe more sun than you should?
Well, I don't really want to go into that right now, but certainly people should avoid getting too much sun on their skin, and the barometer of that is I believe that a person should never have a sunburn. But we're not discussing skin issues today.
Back to vitamin D, that's fine.
We're going to go back to vitamin D. So what I found is that to get above that 75 nanograms per milliliter level. Most people, and there's a variance between different people, that we have vitamin D receptors in our body. It's actually a gene called VDR, vitamin D receptor gene, that varies from person to person. But for the most part, I have people take 5,000 units in the summer and 10,000 in the winter.
Okay. And so this is not just to keep you from getting rickets, though. This is a lot more than that.
This is to optimize your level of vitamin D. And like I say, I'd like to have a person tested to make sure that they are above that 75 nanogram per milliliter mark in their blood. With some people, they have to take a lot more. I have patients who need to get above 20,000 units a day to get above that 75 nanograms per milliliter. I have other patients that only have to take about 5,000 units year round to be above that.
I got it. So do you want to, where do you want to go with this next? We could talk about what are the different health benefits that vitamin D offers, because it seemed to me it operated in a lot of different ways in the body.
Yeah, it's hard to be specific with vitamin D because it benefits a person on so many levels. And you could just say anything you can think of for health improvement or prevention is going to be enhanced with higher levels of vitamin D. In fact, those studies out of Scandinavia I was talking about were looking at all causes of morbidity and mortality, which is kind of a medical term meaning all causes of illness and death.
Okay.
And they were reduced, both illness and death, with higher blood levels of vitamin D until a person got up to about 100 nanograms per milliliter.
I see. So broad spectrum, it just kind of, I mean, as you're saying it, vitamin D does so many different things that are beneficial that you can't really pinpoint a few specific things, but overall, it's better health and you're less likely to die.
That's correct.
It's good enough for me.